Orthopedics has seen a remarkable change in the last 2 decades, probably one of the specialties which has seen the most remarkable change. When I started off as a postgraduate, I still remember the patients being on traction, laid up in bed after a broken bone for months together for the bones to heal up. And today we never see that, and the average stay of orthopedic or a patient who's broken his leg or arm is about 2 days or 3 days, because the technology has changed dramatically. Our ability to be precise with what we do has changed dramatically. More than anything else, we have understood the biology of human, how the tissues heal in our body. So our understanding has made us so much safer as surgeons, and we know how to work with the nature and get the bones to heal, get the tissues to heal, and how to get these people back to work as quickly as possible. Old habits die hard, and some people hold on to the old habits without adapting themselves to the change, and both with technology and understanding. I think that's a mind block. That's a mind block which needs to go. And we as people who are responsible for teaching, responsible for holding hands for the younger generation, always tend to share with the young people, and that's when one learns and moves on as well. So teaching is also makes you learn a lot. So one adapts to the newer technology and newer understanding to give better results. For example, at one time we used to fix the broken bone like the carpenters would do, very, very rigidly, and hold the pieces together, and we thought that's the best way if we can give the results. But today we understand the biology is more important. It's not how rigidly, how every jigsaw puzzle is fixed back, but how you disturb the environment, not to disturb the environment within the human body, and just hold it together, the bones together, so that the nature can do the job and heal it. Because through this year, since I took over as the president, our focus has been to look at what the generation next needs. We've all been young at some point of time. We know what we have gone through. There's always a feeling that the seniors won't let in the younger people to take the prime spots. I always believed that what a young person lacks in experience has to be made up by enthusiasm. The only thing is the enthusiasm has to be tempered in the right way, because you could equally go wrong with that enthusiasm. And that's the role this Karnataka Orthopaedic Society conference, and as a president through the year we have tried to do. We did a few programs through the year and in the annual conference as well. We are trying to get the seniors to on the stage with the younger people and bridge the gap of understanding between the two. There are a few panel discussions of that kind in this conference. We are also conducting an exclusive workshop for the young orthopedic surgeon, the postgraduate and the young orthopedic surgeon. What are the career opportunities both in India and abroad? We have speakers from US, speakers from UK, and speakers from India speaking about how there are opportunities and how one can have a career which is vertical rather than moving horizontally. The English gentleman who's going to be speaking on the podium for all these young orthopedic surgeons is going to tell them exactly how the training opportunities in England are and how to get into that system, what exams you need to pass, how you need to go about and get into the training system of the British system of medical practice. And once you get in, what do you expect? That's very important for the young man to know. He could go with stars in his eyes, and all he finds himself doing is a senior house officer's job. That's not what it is all about. So realistic expectation of what is possible and how long it will take and what will happen after he finishes his training. These are all eye-openers. When we were young and we were trying to go over to England and work, we did not have this complete understanding. We just went in with the enthusiasm and only to realize later what it has to offer. this year's conference will give them a perspective of what the current orthopedics is all about. It'll open the eyes of the younger generation to see where the opportunities are and what direction to take. And I sincerely hope that the orthopedic surgeon comes of age and sees a window of opportunity to deliver the best possible to the society and community, instead of always lamenting of lack of facilities or lack of this or that. Today all that is possible in tier 2 cities, in the big towns. One needs to be abreast with what is happening, one needs to be focused, and one needs to be ambitious, and hopefully this conference will stimulate in all these 3 directions.